Hi everyone, welcome back. I'm Pooja and we'll be continuing our oral radiology series for the dental hygiene boards by identifying structures and pathology. Let's get started. Let's start by taking a look at some of the normal structures that we can see on a panoramic image. The first is the mandibular condyle, which is a rounded posterior portion of the mandible that articulates with the temporal bone and is a part of the temporomandibular joint. Next is the maxillary sinus, which is an air-filled cavity located above the roots of the maxillary posterior teeth, and it appears radiolucent. Then is the hyoid bone, which appears as a floating radiopaque structure below the mandible. Then is the zygomatic process, which is a radiopaque U or J-shaped structure above the maxillary molars. Then we have the coronoid process of the mandible, which is an anterior projection of the ramus, and it may appear superimposed over the maxilla. Then we have the maxillary tuberosity, which is a rounded bony prominence behind the maxillary molars. Following, we have the incisive foramen, which is a round radiolucent area between the maxillary central incisors. Then we have the mental foramen, which is a small radiolucent area near the premolars on the mandible. And one of the most commonly misinterpreted findings on a panoramic X-ray is a faint horizontal line between the molar roots. And this is often a ghost image of the contralateral mandibular border and is not a fracture, it is not pathology, it is just a projection. Moving on, we have the lateral border of the orbit, which is a radiopaque outline of the eye socket, the zygomatico-temporal suture, which is the suture between the zygomatic and temporal bones, the zygomatic process, which is a radiopaque U or J-shaped structure above the maxillary molars, the styloid process, which is a thin radiopaque projection extending downward from the temporal bone, the hamulus, which is a hook or a finger-like projection from the medial pterygoid plates, the infraorbital ridge, which is a radiopaque line below the orbit, the middle cranial fossa, which is the portion of the skull base housing the temporal lobes, and it appears as a radiolucent area, the pterygomaxillary fissure, which is a teardrop-shaped radiolucency between the maxilla and the pterygoid process, the soft palate, which is a radiolucent soft tissue structure posterior to the hard palate, the uvula, which is a projection of the soft palate and it may appear as soft tissue in the midline, and lastly, the cervical vertebrae, which appear as vertical radiopaque structures at the two sides of the image. A few more structures we need to cover are the external auditory meatus, which is the ear canal, and it appears as a round radiolucent area posterior to the TMJ. Adjacent to that is the articular eminence, which is a bony eminence anterior to the mandibular fossa, and it's a part of the TMJ. From the nose, there are a few important structures we need to know. The nasal fossa is an air-filled space in the nasal cavity, and it appears radiolucent. Adjacent to that is the nasal septum, which is a radiopaque vertical line that divides the nasal cavity. Below that is the anterior nasal spine, which is a V-shaped radiopaque projection of bone at the nasal base. And adjacent to that is the inferior concha, which is the bony projection in the nasal cavity that appears radiolucent. Moving along, we have the pterygoid plates, which is a radiopaque projection of the sphenoid bone, and it's located behind the maxilla. Moving along to the mandible, we have the internal oblique ridge, which is a radiopaque line on the internal surface of the mandible. And we have the external oblique ridge, which is a radiopaque line on the buccal surface of the mandible, extending from the ramus forward. Moving along, we have the infraorbital foramen, which is a small radiolucent hole below the orbit, the infraorbital canal that carries the infraorbital nerve and the vessels. Moving along, we have the hard palate, which is the bony roof of the mouth, and it appears as a horizontal radiopaque line. Below is the tongue, which can appear as a faint radiopaque shadow above or behind the maxillary teeth. Moving on to the mandible, we have the mandibular canal, which is a radiolucent band within the mandible housing the inferior alveolar nerve. And the mandibular foramen is the opening on the inner surface of the ramus for the entry of the inferior alveolar nerve. The sigmoid notch is a depression between the condyle and the coronoid process, and it can be noted over here. The submandibular gland fossa is a radiolucent depression below the mandibular molars. A few more structures to be aware of in a panoramic X-ray are the earlobes, which is a soft tissue shadow near the angle of the mandible, the glossopharyngeal airspace, the airspace posterior to the tongue and the oral cavity, the mental fossa, which is a depression on the anterior surface of the mandible, and below that is the genial tubercles, which is a radiopaque ring-like structure at the midline below the mandibular incisors, the palatoglossal airspace, and this is the airspace between the soft palate and the tongue, the posterior pharyngeal wall, which is a vertical soft tissue outline posterior to the oral pharynx, and finally the mental ridges, which are radiopaque lines in the mandibular anterior region. However, we can also see dental anomalies and pathologies when we look at panoramic image, so let's go ahead and take a look at some of those. The first example is a mesiodens, which is a type of supernumerary tooth that appears between the permanent maxillary central incisors, and on this radiograph you can see it clearly positioned right at the midline. Next, we can see pulp stones, which appear as small radiopaque spots within the pulp chamber or the root canals of the teeth, and these are calcified masses, and in most cases they don't cause any symptoms, they're asymptomatic, and they're usually just an incidental finding on the radiograph. A panoramic X-ray can also reveal signs of osteoarthritis like condylar erosion or flattening, but it's not the only imaging tool we rely on. For a better look at the articular disc, we turn to an MRI, which is a great tool for soft tissues since it can pick up on the subtle differences in water content and tissue structure. On the other hand, a CBCT gives us a detailed, high-resolution 3D view of hard tissues like bone, which make it ideal for closely examining the joint itself. Now let's take a look at a couple of lesions that might show up on a panoramic, and both of these will appear as radiolucent areas or dark spots on the image. So the first one is a traumatic bone cyst, and it's benign and often linked to some kind of previous trauma. And the second one is an odontogenic keratocyst, also known as a primordial cyst of Gorlin syndrome. So this one comes from the dental lamina, and it tends to be more aggressive and usually requires close follow-up. And learning these two terms is important for the exam, so remember an odontogenic keratocysts are associated with Gorlin syndrome. Another lesion we might come across is an odontoma, and this is a benign tumor that's made up of tooth-like structures, and on a radiograph it'll show up as a radio-opaque mass with irregular edges. You'll often see a cluster of small calcified structures that kind of look like teeth, and it's all surrounded by a radiolucent zone. Next, we have mandibular tori, and these are bony overgrowths that can develop on the inside of the lower jaw, and they're usually kind of tucked right under the tongue, and you can catch them on a panoramic, but they're best viewed with a CBCT. One of the most common findings we see on a radiograph is dental caries, and they typically become visible only after there's been about 30 to 40% mineral loss, so early lesions may not always be detected or show up clearly on x-rays. Next, we have attrition, which happens when enamel or dentin wears down from grinding, and it can also show up on a radiograph. In this case, you can see that the crowns of the lower molars are worn down and they appear kind of flat. Let's talk about periapical radiographs now and take a look at some of the normal structures. So when we look at a periapical of the maxillary incisors, we can often see a clear view of the nasal spine. And around the teeth, we might also spot the bone marrow, and if we look really closely, we might also notice nutrient channels running between the roots of the teeth on the x-ray. Dental radiographs are also very helpful when it comes to spotting dental anomalies. They can help us identify things like conjoined teeth and differentiate between fusion, gemination, and concrescence. So fusion happens when two adjacent teeth join together at the enamel, dentin, and sometimes even the pulp, and usually it leaves one fewer tooth in the arch unless there's a supernumerary tooth involved. Gemination, on the other hand, happens when a single tooth germ splits and it creates a bifid crown with a shared pulp canal, but the tooth count stays normal. And then there's concrescence, where two fully formed teeth join by the cementum alone with no change in the tooth count. And here's what the three aforementioned dental anomalies look like on x-rays, with fusion showing union of the adjacent teeth, gemination showing a single tooth germ splitting, and concrescence showing teeth joined by the cementum. Supernumerary teeth or extra teeth can also show up on an x-ray, and in the image on the left, we're looking at a specific type of supernumerary tooth called a mesiodens, and we touched on it briefly earlier, and this typically appears between the two permanent maxillary central incisors. Another dental anomaly we can spot is a dens in dente, which kind of looks like a tooth inside another tooth, and that's because the enamel folds into the dentin. Pericornitis is the swelling and the infection of the gum tissue around the wisdom tooth, and it can also show up on an x-ray. And it's important to remember that infections in the mandibular third molar region can sometimes drain into the submandibular lymph nodes. I've had pericornitis before, and it's not a fun experience. You may also spot a foreign body in the radiograph, which can sometimes be hard to identify. It might show up as a purplish lesion or discoloration when you look inside the patient's mouth. And in this case, it could be an amalgam tattoo, which appears when tiny bits of dental amalgam get embedded in the mucosal tissue, and it's usually from a dental procedure or accidental fragments that got left behind. Now let's talk about resorption, and the first one we need to discuss is external resorption, and this is the loss of tooth structure that begins on the outer surface of the root and progresses inward. And on the x-ray on the left, there's external resorption of the distal root of tooth number 18 as a result of the impacted tooth number 17 pushing against it. Meanwhile, on the right-hand image, internal resorption occurs when the tooth structure is lost from inside of the root canal due to inflammation of the pulp tissue. And this can sometimes occur during whitening procedures when there is poor canal sealing during internal bleaching, which can lead to internal resorption. Our first sample question asks, which of the following dental anomalies is visible in the radiograph? All right, guys, take a second to pause the video and to answer the question. Okay, let's take a look. The correct answer here is D, and here we can see a supernumerary tooth between the maxillary incisors, which is characteristic of a mesiodens. Our second sample question asks, what is the next step after your diagnoses? All right, guys, take a second to pause the video and to answer the question. Okay, let's take a look. The correct answer here is C, plan for surgical extraction. So a mesiodens is often extracted if it causes crowding or misalignment of the teeth. It can delay the eruption of the permanent incisors. It can lead to an infection or a cyst formation. It can affect the appearance of the permanent central incisors, or it can interfere with orthodontic treatment. So for all of those reasons, removal or surgical extraction of the tooth helps prevent any further complications, and it improves dental alignment. Sample question 3 asks, what pathology can be seen in the following radiograph? All right, guys, take a second to pause the video and to answer the question. Okay, let's take a look. The correct answer here is A, odontoma. And an odontoma shows up as a radiopaque mass with irregular margins surrounded by a radiolucent zone, and an odontoma includes multiple small calcified structures that may resemble teeth. Our final practice question asks, which of the following best describes the bilateral horizontal line extending beneath the apices of the mandibular molar roots in the panoramic radiograph? All right, guys, take a second to pause and to try the question. Okay, let's take a look. The correct answer here is A, ghost image of the contralateral mandibular border. And this happens because panoramic imaging picks up the structures outside of the focus area and overlaps them onto the image. And it can show up as a faint horizontal line underneath the mandibular molars, and it can sometimes be mistaken for a fracture or any other issue. So be careful not to confuse it with the inferior alveolar canal, which appears as a well-defined dark band, or with a machine artifact, which usually shows up as a more consistent straight line on the image. As we come to an end, let's do a quick recap of what we went over in this video. The first point, radiographs may be used to identify normal structures and pathologies. And the second, different radiograph types can show the same structures. All right, guys, that's it for today's topic. Thanks for watching, and I'll see you next time.